everyone. Today I would like to make a presentation about tic disorder. I guess many of you guys have heard of the name before, but today we'll dive a little deeper. My presentation is divided into 6 parts. Firstly, we'll look at the definition, and then the cause, the types, the symptoms, the treatments, and last I prepared some simple quiz, so please pay attention. Let's begin. The definition. Tics are brief movements or sounds that occur intermittently or unpredictably out of a background of normal motor activity. In Korea, 2 years to 19 years old children have a percentage of 2.6% and adults have a percentage of 0.008% to 0.024%. Two times have increased in 10 years. Oh, sorry. Next, the cause. It is not clear what causes tics. However, there are thought to be changes in parts of the brain. Tics can run in families and are likely to be a genetic cause in many cases. Tics can happen alongside other conditions such as ADHD and ODCs, and can be triggered by taking illegal drugs such as cocaine or amphetamines, and are occasionally caused by other serious conditions such as palsy or Huntington's disease. The types. There are 3 main types: Tourette syndrome, persistent motor or vocal tic disorder, and provisional tic disorder. For Tourette syndrome, a person must have 2 or more motor tics and at least 1 vocal tic. Hold on, please. Have had tics for at least a year and have symptoms that aren't due to taking medicines or other drugs due to having other conditions. For persistent motor or vocal tic disorder, a person must have 1 or more motor tics or vocal tics and have tics that started before the age of 18. For provisional tic disorder, a person must have tics. Tics. 1 or more motor tics or vocal tics, and have been present for no longer than 12 months. Next, the symptoms. The symptoms can include blinking, jerking or banging their heads, clicking fingers, touching other people, grunting or sniffling and coughing, and repeating same sounds or phrases. In a number of cases, this can be something offensive. Next, the treatments. There are actually no cure for tic disorders. The treatments are aimed at controlling tics. Meditations to help control tics can include ADHD meditations, central adrenergic inhibitions, botulinum injections, and blocking and listening dopamine. If you don't have any questions, I'll move on to the quiz. First question: what is not a symptom of tic disorder? Yes, see? Okay. Second question: what are the types of tic disorder? There are 3 answers. Okay. Yeah. It starts with P.
Professional.
Yeah. Here, yeah. It's not B, but due to some error, it says B. The answer of number 2 is Tourette syndrome, persistent motor or vocal tic disorder, and provisional tic disorder. It's the end of my presentation. We must have the correct awareness of tic disorders and create a society where people suffering from tic disorders can receive support without prejudice. Thank you for listening.